Thank you, Dr. Irfan. So ultimately, point here which we are trying to make is it's not never late. So start right away wherever you are. At least you start noting down your patients who are coming to your OPD digitally or on your registers, if possible digitally, because that's where you can retrieve your data in quite an efficient way. And if you are using some sort of a tool, that's fine. Otherwise, what Dr. Irfan and Dr. Sarthak and we are using is in Oncflow, thanks to Sameer for providing that tool. That's quite a comprehensive tool. In fact, in the end, I would very briefly present that also. So I'll just proceed with the further presentation and quickly finish it off. So we have also published collecting this real world data almost in all of the majority of journals. These are all in last 1.5 years. And one is an AI paper, one is a clinical paper, and these all are from the Oncflow platform, which we actually very religiously use in our department. So very quick few questions. From all our panelists, because they are all our young radiation oncologists and oncologists. So how do you collect, analyze, or publish your data? What is your timeline? So first of all, is there any value actually? Most of the time people say, okay, why do I waste my time in this? I just come and see patient and go back home and collect money. That's it. So is there any value in doing all these kind of an effort? Yeah, we can start with Naman. What do you think?
Yes, sir, definitely there is a value to adding the data. And in our setting, we are preparing a yellow colored file which has all the clinical relevant details, including examination and biopsy from PET scan. And then we have prepared an Excel sheet, site-wise, tumor-wise distribution, and then age and sex-wise, that's it.
Yeah.
And then after discussion in tumor board, we are also mentioning that what has been done and what was the stage.
Because that's the right approach, because you see, what happens is we see patients and then we record everything in the file, and 5 years down the line, then we go back and try to check what exactly was there in the file. And I can tell you that you will find a lot of mess, and that data is not analyzable because many things would have been missed. So if you design your clinical practice in such a way that you have some pre-decided thing which you make mandatory that at least this information should be there, so that can help you. So that is where, whether you use Excel sheets, whether you use Oncflow, whatever, any software, but at least you should start working towards your prospective data. This is what is a prospective data. So you design, you define definitions, what you are going to collect, you validate the things in a consistent way, you collect that data. If you are saying sex, you say sex, otherwise you say gender, whatever it is, it should be consistent, and then collect that data. That is something which we should all take. Yeah, Dr. Colonel Ashok.
There's only one line to summarize this slide, and the entire thing is publish or perish.
Publish or perish, yeah, that's a wonderful analogy.
It helps us to audit ourselves also over
exactly,
the time.
that is also a very important point. It's not only about publishing. So sometimes you need to know what exactly you are doing, what are your results, if is there something wrong, because I realize when we are using Oncflows, then you can see that on the dashboard it will tell you that this month how many patients you have seen assessed for radiation toxicity. And suddenly we realized that in one particular month we had grade 3 radiation toxicity, suddenly they rose up. So that was there when it clicked, and then we checked back, and probably we found out that that was a one particular machine where it was patients who were treated on that particular machine were getting more grade 3 reactions. And then we went back and discussed with our physicists, and then we found out something, and then accordingly we could rectify that. So this is the power of real world data. You can publish, you can actually get insight into your own work, what you are doing, right or wrong, and then you can actually modify yourself, your practice also.
Especially it helps us in our childhood cancer survivors a lot. Going back and finding out the dosimetry is very difficult. So if you go on collecting and documenting at that time, it's very helpful.
Agree. So what tools and softwares you are using? Very quickly, just a one line, and I'm going to finish it. So is there any tool or something you are using, Dr.
We have just started using Oncflow, and we also have our HIS very rudimentary.
And any other software for analysis or something? Or you depend on statisticians?
Statisticians.
Okay.
We're collecting in Oncflow, but we're analyzing in SPSS.
And Dr. Sani?
I started actually using Oncflow, and I must say that it's a good tool to collect the data, because it will, save the time actually. You need not to repeat. First make the files and then collect the data and then
Later on, yeah.
correct it.
Yeah, Dr. Robin, what's your experience?
Yeah, I have my own set of challenges. Yes, I did have used Oncflow for a certain amount of time, but then there were some issues that I couldn't continue. But definitely the experience was that I could able to structure my data collection much better. I have my secretary who is already collecting most of the data, but the format in which we collect and report, store in our system is something we find difficult in the long run, where when we need to find out one particular set of patients like SBRT prostate or SBRT lung or IGRT or DIBH. So that analysis and extraction of data became a challenge, is still a challenge with us. We have been using Oncflow to a limited extent and did find that this extraction is probably the best thing you will find in future. So once you have a structure, so you don't have to rely on your own memory. Oh, I had those 210 patients which I had to report, or you have some paper which you have written in your Excel sheets. Let me find out those soft tissue sarcomas and then go and find out what dosimetries. So probably if you start collecting in a structured format as it has been shown in Oncflow systems, which Sameer has presented to us, we did it. So extraction is something which is the best thing and would be helping us in future also to publish our...
So prospectively, you spend more time in collecting data, and retrospect you try to analyze, then there it saves a lot of time. That's what you were saying. Bashir, yeah, Dr. Irfan. So I'll just come to the next question. I think we have already done that. So anybody, do you use any AI-based tool? Anybody from the panel or from the audience, if anybody is using any sort of AI-based tools for routine workflow management?
Sometimes we use R for software for statistical analysis, but coding we'll do from ChatGPT.
But that's an analysis. I'm talking about when you are actually seeing patients in your routine clinical practice. So is anybody is using any sort of AI tools in any clinic? Because we were hearing a lot of things from afternoon that AI, but if you look at the real practice, I don't think anybody is using a real AI in their routine clinical practice. So forget those few things where you are using some imaging-based AI tools for some sort of an analysis, but not in a routine clinical practice. So yeah, Bashir.
In addition to Oncflow, there's one Pulse Dash which we have started using for our patients. This is a patient-friendly app in which patients, whenever they start their simulation, we tell them to download the app, and they can report their toxicities. They have a calendar, everything is there, and if they have some adverse events that happen to them during the course of radiation, they can just put it on the app, and this will be reported in our system. So this is one more thing which we have added to the
Great. I think we are, yeah, Dr. Robin, quickly.
Other important thing on AI, the real AI, which they said not deep learning, machine learning, but the transformative, probably I think it's the one, the tool where you can scan all your documents and it extracts the information and structures it to you and presents you in a particular form. So it is also available in this. Our hospital, Apollo Hospital, also introduced. These are still in, these are being refined to understand your language. Even if something you have written in your handwriting, they recognize your handwriting and structure it to in a digitized form. So this way, and more importantly, it structures it where it has to fit. So say you have written a histopathology report with your hand, the IDC, T1, T2, so it automatically structures it into format where you can use it for future use also.
So structured data, that is what, so I'll not go into these things. I think we have already discussed this in detail. So finally, I'll just